stigma around suicide and mental health keeps people from getting the help they need. Talking openly about suicide and mental health allows people to reach out without the fear of judgment and is a simple, effective way of supporting the mental health in our community. We will be discussing common suicide risk factors and warning signs that we, as potential helpers, need to be aware of. We think that by working together, we can prevent suicide. It is our goal to spread awareness that suicide is preventable and to train our community with the skills to save lives. There is no one reason why people become suicidal. Instead, people become vulnerable to suicide due to a combination of biological, social, and historical risk factors. Risk factors are characteristics or conditions that increase the chance that a person may attempt suicide. People may experience painful, disturbing, and/or traumatic events that overwhelm the coping mechanisms they have developed. We can examine 3 categories of risk factors that may increase the likelihood of a suicide attempt. Health risk factors may include a mental illness, such as depression, anxiety, or bipolar disorder, substance use, a chronic illness or chronic pain, or a traumatic brain injury. Environmental or social risk factors include a loss of housing, financial crisis or loss of income, relationship problems such as divorce, breakups or bullying, unemployment, and the access to lethal means like firearms. Historical factors like a family history of suicide, previous suicide attempts, or exposure to traumatic events may increase risk. The truth is that people who attempt suicide are in pain, whether it is emotional, physical, or social. They don't see a way out of their pain. They feel overwhelmed, lonely, and hopeless. When someone is contemplating suicide, they may show changes in the way they talk, behave, or act. Most people who take their lives exhibit 1 or more warning signs. It is important to look for a change in behavior or the presence of entirely new behaviors, especially when related to a painful event, loss, or change. Someone thinking about suicide may talk about killing themselves or joke about killing themselves. They may say they feel trapped, are hopeless, or feel like a burden. Or they might talk about how much pain they're in and how tired they are. A person contemplating suicide may also begin behaving differently. They might isolate themselves from family or friends. They may begin giving away prized possessions, or sleeping too much or not at all. They might become aggressive or start using substances, like drinking or smoking unusually. And finally, someone thinking about attempting suicide may have major mood changes. They might become very depressed, anxious, or agitated. They might feel shame or embarrassed by their thoughts of suicide. And on the other hand, they might abruptly start acting happier or more relieved. To learn and read more information about suicide risk factors and warning signs, please visit the American Foundation for Suicide Prevention at afsp.org or the Suicide Prevention Resource Center at sprc.org. We will be discussing safety planning in our next Suicide Prevention Basics video.